Okay, next to the last of these lessons in the EMR part of our emergency medical technician course. So just a couple more. This one's pretty quick, I swear it is. And so I know you've seen this before several times, but it's important, so we keep showing it to you. And so, yes, be nice, yes, be safe, but let's also be good. And in this case, we're going to be good at getting some history, some valid history, some history that matters, by having a conversation with our patient rather than an interrogation of our patient. And we're going to pass this on and help the medic crew help Mrs. Smith. It is the final of the 5 steps in our 5-step assess and treat. Is it a code? If it's not a code, we need to talk about circulate, ventilate, and oxygenate, rapidly find and fix things that we can fix, record some vital signs that we get accurately and legibly, and then get some history. Now, the EMS notes form, the little blue form, works very well for this. The medics love it, and it helps us document what we've asked. And on the sides of that form, on the margins, down one side is SAMPLE, that's for sample. That's a mnemonic that has elements of a good history in it. And on the other side is OPQRST, that is EMT level stuff, but that helps us ask some valid questions and drill down on pain. Not for EMRs, not a secret. You're welcome to see it. You're welcome to try to learn to use it, but not if it distracts you. I don't even care that you know sample as an EMR, because you know what? The National EMS Education Standards don't require that you know sample as an EMR. But we think you're smart. We think you're better than that. We know you're going on to be EMTs, so you might as well learn sample, but we're going fast with this EMR part. It's first, it's fast, it's only what you need to know, it's what Mrs. Smith needs you to be able to do. So we're not going to beat you up over sample, but we are going to introduce sample, and we'll do a lot of that in class. Hey, whatever you get on history, write it down, and write it down so somebody can read it. One of the things in sample, the M, is medications. Let me tell you real quick what sample stands for. S is the other signs and symptoms, other things bothering you. So example, Mr. Smith calls for chest pain. Chest pain is his chief complaint, his chief concern. But what else might he be having? Well, he might be short of breath, he might be nauseated, he might be lightheaded. That's S. Those are the other things going on. A is for allergies. M is for medications. P is for pertinent past history, not every little piece of past history. The fact that he had an ingrown toenail removed when he was 7 is not pertinent now that he's 55 and he's having a heart attack. The L is last whatever. It might be last meal, last bowel movement, last medication, last time he had chest pain, last whatever. And then the E is valid for us. And that's events leading up to this. What's been going on? What's been happening? What was going on when this started? What have you been doing today? Those kind of questions. But the M is medications. And while I think it's a good idea that you know a little bit about some medications at the EMR level, let's just have you collect the medications. If they've got a list, that's great. Then leave those valuable pills at home if the list has dose and name of the medication. But as a paramedic, I look at this list of medicines, and I know a bunch of history real quick off that list. We'd love the list. If not, bring us the actual bottles and put them in a bag and keep them safe. They're very expensive and they're very important to the patient, and they do want them at the hospital because they do want to match up dosages. So bag up the meds. Do not spend your time trying to write out the list of medications. Now, if the guy's only taken 2 things, okay, maybe that's different. But a lot of our patients are taking a bucket load of meds, and we don't need to tie people up writing something down that the medics aren't going to read anyway. The medics want to see the bottles. Well, okay, so what else can we talk about on history? So, you could get some medications and allergies and stuff like that, and that's cool and that's helpful. And then there's this stuff from the EMS education standards called the MOI and the NOI. The M, mechanism of injury, or the nature of illness, which is in English, what happened? What's going on? How can we help? Basically, you want to know why they called. But if you walk in and say, "Why'd you call us?" then that goes down a wrong path and we're not trying to get there. How can we help you? What's going on? How you doing? What happened? Something like that. It would be good to introduce yourself. I don't expect that they remember my name, but I think they appreciate that I gave them my name. And then I try to explain why I'm there. Because remember, the Smiths called for an ambulance, and then a fire truck showed up. And so I kind of have to explain my presence sometimes. And you can then say, hey, this is me. I'm with the fire department. We're here to help. What's going on? And you can kind of walk right into it. And so their chief complaint, now being called chief concern, a little more PC these days, I guess. Chief concern, because complaint sounds kind of negative to some people, but whatever. Chief concern. What's going on? What's bothering you the most? What do you think is the biggest thing going on? It's important that we hear them. It's important they get to state it and we get to hear it. What they think is the highest priority. It may not be their biggest threat, but it's what they think is their highest priority. For instance, maybe the person called us and they feel weak and nauseated. That's their chief concern. We may end up finding out that they're having a heart attack. And so it's not their biggest priority, but it's their chief concern. So we like to go with that. So this recording history has to do with getting some information like, do you have any allergies to foods or medicines? Are you taking any medications? Let me get a list of those or bag them up and the medics will want to see them. What's been going on? What's bothering you the most? Those kinds of things. As we get further in your course and progress past this EMR segment into EMT, we'll actually work with you on sample history. And recording history is the fifth part of that 5-step assessment and treatment plan. And it's an important part, but we shouldn't be messing with that if we haven't dealt with circulate, ventilate, oxygenate, and we haven't found and fixed anything that we can fix. The history is the history, but it is important, but its priority is lower, and that's why it's where it is in the 5-step plan. Again, talk about sample real quick. Get pertinent history. Use that sample if you want. We'll go into much, much more of this in the EMT portion. And you know what? Here's the basic. It's not that you aren't smart enough to do something with that history. It's that in the field setting, at the EMR and EMT level, there's very, very, very little from history that's going to make any difference to you in terms of how you change your plan or what actions you may take. The paramedics, there are a lot more things they can act on, but still, sometimes history is history, and it doesn't make a heck of a lot of difference. So it's at the 5th spot in the 5-spot assessment and treatment plan. It's important, but it's important to keep it in priority.